It's a beautiful day. Maybe you're out with your horse. Everything feels great. But what if, silently, beneath that powerful exterior, a critical danger was actually brewing? We're talking about equine hyperthermia, and it's far more serious than just a horse getting a little bit warm. Today, we're taking a deep dive into the information you've shared with us. We're focusing on the really nuanced world of equine hyperthermia, which you might also know as heat stroke or heat stress in horses. Our mission here is simple: help you quickly get up to speed on this potentially life-threatening condition. We want you to understand its causes, the symptoms, what immediate actions you can take, and really crucially, how to prevent it. And to truly unpack this, I think we need to start with a key distinction. When we talk about a horse getting too hot, it's really important to separate that from something like, say, a fever. They're not the same thing at all.
That's absolutely the right place to start. It's a vital point.
Yeah.
Here's something key for you to grasp. Unlike a simple fever, where the body intentionally raises its temperature, maybe to fight an infection, hyperthermia is different. It's when the body's natural cooling systems are just plain overwhelmed.
Overwhelmed. Right.
Think of it this way. With a fever, your body kind of resets its internal thermostat, sets it higher on purpose. But with hyperthermia, the thermostat itself is working fine. It's just, the body's cooling system, it's natural AC, it's completely overloaded, it just can't keep up. The sources define hyperthermia quite precisely. It's an abnormally high body temperature where that hypothalamic temperature set point the internal thermostat. It isn't altered. But the heat dissipating mechanisms, they're either overwhelmed or they fail.
Okay, so the cooling system breaks down, essentially.
Yes. And when that hyperthermia hits a critical point and it starts causing central nervous system dysfunction problems with the brain, that's what we call heat stroke.
Heat stroke, got it.
And for performance horses, especially after really intense exercise in tough conditions, hot, humid, we often see something called exertional heat illness, or sometimes post-race distress syndrome. This is a really severe form of hyperthermia. It can lead to serious issues with both the brain and the gut.
Wow, okay. So how quickly can things get dangerous then? Especially, when we think about a horse's normal temperature being around, 37.5 to 38.5 Celsius? That's about 99.5 to 101.5 Fahrenheit?
Yeah, that baseline is important. And this is where the horse's unique physiology comes into play. It's actually quite fascinating. Horses are incredible athletes, right? But when they exercise, something like 80% of the energy they expend is converted directly into heat, a huge amount of heat.
80%, that's massive.
It really is. Now, their main way to ditch this heat is through evaporative cooling. That means sweating mostly and also breathing. They do use other methods like conduction, convection, radiation, but sweating is their real powerhouse mechanism for cooling off.
Makes sense.
But they do face a couple of built-in challenges. First, they have a relatively low surface area compared to their large body mass, just, proportionally. And second, their hair coat, while obviously essential and beautiful, can act as an insulator, trapping heat.
Ah, okay, so it works against them in hot weather.
It certainly can. So when we talk numbers, a body temperature over 39.5 Celsius, that's 103 Fahrenheit, that's generally considered hyperthermia. But once it climbs above 41 to 42 degrees Celsius, so 106 to 108 Fahrenheit, that's when you start getting into really dangerous territory.
What happens then?
That's when you can see serious cellular damage. Specifically, the heat starts to denature cellular proteins. Basically, it damages the building blocks of the cells.
Mm-hmm.
And the brain, the central nervous system, is the most sensitive part of the body to this kind of heat damage.
Oh, wow.
Yeah. And if that super high temperature persists, unfortunately, it can lead to something called multiple organ dysfunction syndrome, or MODSL. That's when several vital organs begin to fail, and the liver is often particularly affected.
Okay, that really clarifies the danger and the difference from a fever. So you mentioned it's often complex. It's rarely just one thing causing this, right? You called it a kind of perfect storm.
Exactly. You've hit the nail on the head there. It's usually a combination, a confluence of factors. We can sort of group them into environmental, exercise-related, and then horse-specific factors.
Let's break those down. Environmental factors first.
Sure. So high ambient temperature is the obvious one, especially if it gets above, say, 30 degrees Celsius or 86 Fahrenheit. That's a clear risk. But, and this is crucial, the single most critical environmental factor is high humidity.
Humidity, right. Why is that so much worse?
Well, think about it. Evaporative cooling, sweating, works because the moisture evaporates off the skin, taking heat with it. But if the air is already full of moisture, if it's really humid, that sweat can't evaporate effectively, or at all, sometimes.
So the main cooling system just stalls.
Precisely. It becomes far less effective. That's why just looking at the thermometer isn't enough. Measures like the heat index or the wet bulb clobe temperature, the WBGT, they give you a much better picture of the actual stress on the horse because they account for humidity.
That's a really important takeaway for people. Don't just look at the temperature.
Absolutely. And then you've got other things like lack of air movement, still air, and high solar radiation, direct sun, all adding to the heat load.
Okay. So what's an environmental mistake people might make?
I think overlooking that humidity factor is the big one. Someone might think, oh, it's only 85 degrees, it's not that hot. But if the humidity is 80 or 90%, that's a dangerous situation for hard work.
Gotcha. Okay. What about exercise factors?
Well, strenuous exercise itself, obviously, prolonged or really intense work generates a massive amount of internal heat. And this is especially true for horses that aren't properly conditioned for that level of work.
The fitness level matters a lot.
Hugely. The intensity of the work, the duration, and the horse's underlying fitness, they're all critical pieces of the puzzle. You can't just, pull a horse out of the pasture and expect it to run a long race safely on a hot day.
Makes sense. So environment, exercise.
Yeah.
What about the horse itself? Horse-specific factors.
Yeah, there are quite a few here. Dehydration is a massive one.
How does that contribute?
Well, being dehydrated reduces the horse's blood volume. Less blood volume means less blood can be effectively shunted to the skin surface to release heat. Plus, dehydration directly reduces the amount the horse can sweat, so it hits the cooling system from two angles. Lack of access to water during work is a common issue here.
Okay, hydration is key. What else?
Poor acclimatization. We touched on this, but horses really need time to adapt to hotter climates. It's not instant. We're talking 10 to 21 days, though ideally you give them about 15 days, maybe 3 weeks to properly adjust.
So patience is important when moving horses or when seasons change.
Definitely. Then there are underlying health conditions. Things like obesity, that extra fat acts as insulation. Respiratory problems like heaves or COPD make it harder for them to cool through breathing. Cardiovascular issues too. And then there's a really serious condition called anhidrosis. You might know it as non-sweaters.
Yes, I've heard of that. They just stop sweating.
Completely, or almost completely.
Yeah.
They lose the ability to sweat properly. It's a chronic condition, and it makes them incredibly susceptible to overheating because their main cooling route is gone.
That sounds terrifying for an owner.
It really is. There can also be genetic predispositions. Conditions like malignant hyperthermia, or MH, and HYPP, hyperkalemic periodic paralysis, which affects muscle function, can increase heat sensitivity. Certain medications can even play a role. Some antibiotics, like macrolides in foals, or certain anesthetics, even some tranquilizers or diuretics, like furosemide.
So lots of potential contributors there.
Yeah, and even just being confined in a poorly ventilated stall, or especially a trailer on a hot day without good airflow or shade, that can push a horse towards overheating too.
It really is a complex puzzle then. Knowing all these risk factors seems crucial for anyone around horses, just to sort of assess the situation.
Exactly. Awareness is the first step in prevention.
Which leads us perfectly to the next crucial part, recognizing the red flags. So if you're with a horse, what signs should you actually be looking for? From, mild stress up to a full-blown emergency.
Right. And early detection here is absolutely paramount because, as you say, the symptoms exist on a spectrum. They get progressively worse. In, let's say, mild to moderate heat stress, where the rectal temp is maybe between 102 and 105 Fahrenheit, so 39 to 40.5 Celsius, what you'll often see first is profuse sweating. Sometimes it's even foamy.
Okay, lots of sweat.
Yeah. And the heart rate will be elevated, maybe over 40, 50 beats per minute. And importantly, it'll be slow to come back down after they start working. Their breathing will also be up, maybe over 30, 40 breaths a minute, often shallow and rapid. You might see flared nostrils.
And their behavior.
They might seem lethargic, dull, depressed, just generally off. Maybe their performance drops or they seem reluctant to keep moving. You might also spot early signs of dehydration. Check their gums. Are they tacky? Does the skin stay tented if you pinch it? Are their eyes looking a bit sunken? Dark urine can be another sign.
Okay, those are the earlier signs. What about when it gets really serious? Severe heat stroke.
That's an immediate veterinary emergency, no question. Here, the rectal temperature climbs rapidly. It goes above 105 Fahrenheit, 40.5 C, and can potentially hit 107 Fahrenheit, 41.6 or even higher. And here's a critical, really ominous sign. if a horse was sweating heavily and then it suddenly stopped sweating.
Stop sweating, even though it's still hot and stressed.
Exactly. That is a massive red flag. It means their primary cooling mechanism, sweating, has completely failed. It's shut down.
Wow. That's counterintuitive, but crucial to know.
Absolutely crucial. You'll also see clear signs of shock setting in. A very rapid heart rate, maybe over 60, even 80 beats per minute or more. Very rapid, shallow breathing. Check the gums again. Now they might be pale or dry or even a scary brick red color. The capillary refill time when you press on the gum will be prolonged, taking more than, say, 3 seconds to return to pink. The pulse might feel weak.
Okay, definite signs of shock.
Yes. Severe dehydration will be obvious. And then the neurological signs start to appear, and this is really serious. Stumbling, in coordination vets call it ataxia, muscle tremors. A staggering gait. They might press their head against things. Some develop blindness, seizures. They might collapse, become recumbent, unable to stand, or even slip into a coma.
That sounds incredibly serious.
It is. And on top of all that, other severe complications can develop. Things like colic, severe diarrhea, laminitis, which might actually show up a bit later, acute kidney injury, or a really dangerous clotting disorder called DIC, disseminated intravascular coagulation.
Goodness. Those severe signs just scream, emergency!
Oh.
So, okay, let's say you suspect hyperthermia. What's the immediate game plan? What can you do right there, right then, while you're hopefully getting the vet on the way?
Right. Immediate and aggressive cooling is the absolute #1 priority. Time is critical. First thing, stop all exercise immediately. Doesn't matter what you were doing. Stop.
Yeah.
Then get the horse into the shade, preferably somewhere with a breeze and possible.
Okay, stop work, find shade, then what?
Then, the most critical step. Start hosing the entire body continuously with cold water. And we mean cold water. Straight from the tap is usually fine. You don't need ice water. In fact, some sources suggest avoiding ice packs initially, as they might constrict blood vessels in the skin.
Just keep the hose on them.
Continuously. Drench them. The goal is rapid evaporative cooling. The sources really emphasize not scraping the water off immediately.
Oh, interesting. I thought you were supposed to scrape.
There's some debate. Maybe scraping helps remove the heated layer if you immediately reapply more cold water. But the absolute key, the consensus, is the continuous application of lots of cold water over the whole body, especially the large muscle groups, neck and belly. Let that water evaporate. That's what pulls the heat away. Constant drenching.
Okay, constant cold water hosing. What else?
If you have fans, use them. Point them at the horse to increase air movement and boost that evaporative cooling effect. Offer small, frequent sips of cool water to drink, not ice cold, just cool. If you have electrolytes, you can add them to the water. That's helpful.
Okay, and monitoring.
Yes, very important. You need to monitor the horse's rectal temperature frequently, like every 5 to 10 minutes. Keep up the aggressive cooling until that temperature starts to come down into a safer range, say around 102 to 103 degrees Fahrenheit or 39 to 39.5 Celsius.
Why stop there? Why not get it back to normal?
Good question. You want to avoid overcooling, which can cause its own problems, like shivering, which actually generates heat. So you cool aggressively until they're out of the immediate danger zone, then you can ease off, but continue monitoring closely.
Right. Makes sense. And it sounds like even with all that first aid, getting a vet involved is still pretty crucial, especially if it looks serious to begin with.
Oh, absolutely. Especially for anything beyond mild heat stress, veterinary intervention is often essential. Those first aid steps are vital to start the cooling process immediately, but there's more to it.
Why is the vet visit so important then? What else do they do?
Well, it's not just about getting the temperature down initially. It's about dealing with the systemic consequences, the dehydration, the electrolyte imbalances, the potential organ damage. Once the vet arrives, they'll assess the horse, continue guiding the cooling efforts if needed. But crucially, they'll likely start intravenous or IV fluids.
IV fluids, why are those so important?
They do several things. They combat the dehydration directly. They help restore normal blood volume, which supports the cardiovascular system. And better blood volume actually helps improve blood flow to the skin, aiding heat dissipation. The vet will also assess and correct electrolyte imbalances, which can get seriously out of whack. They might administer medications like NSAIDs, nonsteroidal anti-inflammatories, not really to reduce the fever, because remember, it's not a true fever.
Right, the thermostat isn't reset.
Exactly. But the NSAIDs help combat the inflammation that widespread heat damage can cause throughout the body. They'll also usually draw blood for analysis. This helps them assess organ function, checking kidney values, liver enzymes, and monitor for those really serious complications we talked about, like kidney failure, DIC, or even laminitis, which sometimes doesn't show up for days or weeks later.
So it's really about managing the aftermath and potential complications too.
Precisely. It's intensive supportive care.
That paints a really clear picture of the whole process, from immediate action to vet care. So what about the longer term? What's the outlook for a horse that's had a hyperthermia episode? And maybe more importantly, how do we try and prevent this from happening in the first place?
Good questions. The prognosis, the outlook, really depends on the severity and how quickly treatment was started. For mild to moderate cases, if they got prompt and aggressive cooling and care, the prognosis is generally pretty good. Most horses recover fully. However, for severe heat stroke, especially if that core temperature got really high, say over 106 Fahrenheit, 41°C, for a prolonged time, or if there were severe neurological signs like collapse or seizures, then the prognosis becomes much more guarded, even poor.
So it could be fatal.
Sadly, yes. Mortality rates can be significant in severe cases. Even survivors might need extended rest, sometimes weeks or even months, to fully recover. And they need careful monitoring for any lingering issues, like potentially developing permanent anhidrosis, becoming a non-sweater afterwards.
Right. So prevention is definitely the best medicine here.
Absolutely paramount. And a lot of it comes down to smart management and awareness. I've seen cases where even really experienced riders got caught out, maybe by a sudden spike in humidity they weren't expecting. It really hammers home why gradual acclimatization is so important.
That 10 to 21 days you mentioned?
Yes, ideally give them 15 days or more. It's not just a suggestion, it's really non-negotiable for safety when moving to a hotter climate or dealing with seasonal changes. Don't rush it. Also, make sure the horse is properly conditioned for the work you're asking it to do. Fitness makes a huge difference in heat tolerance.
Okay. Acclimatized condition. What else?
Hydration and electrolytes are critical. Always ensure they have constant access to fresh, clean water, and supplement with electrolytes, especially before, during, and after exercise in the heat. Salt blocks are good, but electrolytes in feed or water are often needed too.
And timing of exercise.
Yes, simple but effective. Avoid riding or strenuous work during the hottest and most humid parts of the day. Early morning or late evening is usually much safer. Always provide ample shade when they're turned out. Ensure good ventilation in stalls and especially in trailers. Water access and turnout is vital too.
What about grooming? Does clipping help?
For horses with long, thick coats, yes, clipping them can significantly improve their ability to lose heat. It makes a real difference. And then there are those specific cases. Identifying horses with known genetic predispositions like MH or HYPP is crucial, especially before anesthesia or planning intense work. And like we mentioned, being mindful with foals on certain antibiotics, keeping them cool and shaded, it's all part of the picture.
This deep dive has really clarified things for me. That serious distinction between hyperthermia and fever, highlighting that critical, often missed role of humidity, and underscoring that really ominous sign when a horse stops sweating. Most importantly, I think, it's shown us the immediate, aggressive cooling steps that can genuinely be a game changer. This knowledge feels incredibly empowering for anyone who spends time around horses.
Yeah, and I think understanding the horse's unique physiological challenges with heat, it really helps us appreciate just how finely tuned their systems are, but also how quickly they can be overwhelmed when conditions are tough. It kind of leaves you wondering, doesn't it? How do we continue to balance their incredible athleticism and our partnership with them, especially with the increasing climate challenges we seem to be facing?
That is something truly worth considering. Thank you for trusting us with your sources today and for joining us on this deep dive. Stay curious, everyone, and I'll see you next time.